Brian Norton is running in the Republican Party, and Tina Polsky is running as a Democrat in the upcoming election, November election. So I'm going to start ladies first. So Mrs. Polsky, the floor is yours.
Thank you so much, Daniel. So I am the current state representative for District 81, which covers the area you mentioned, West Boca, also West Delray, West Boynton, West Lake Worth, and Belglade, South Bay, and Pahokee, the three cities of the Glades. So I was elected in 2018. That was my first political position. I had been very active in the community prior to that, starting my own charity and being involved in various organizations like the Anti-Defamation League. I have raised my children here in West Boca. They are now 16 and 19. I'm married for 24 years to my wonderful husband, Jeff. I am a lawyer. I practiced in New York. When I moved to Florida 15 years ago, I decided to become a mediator. And that is my profession, besides being the current state representative. As I said, I'm involved in many activities in the area, and just love to be involved in civic and community affairs. It has been the honor of a lifetime representing District 81 in the Florida House. And when this great opportunity came up to run for State Senate District 29, opportunities like that don't come up too often. I decided to jump in and take the risk of potentially losing an easy incumbency in House District 81 because I saw the opportunity to run for Senate as a great chance to represent more people, 3 times as many, represent more cities, and be able to have a greater influence, perhaps. The Senate is a chamber where there's more bipartisanship, where you can get your legislation heard, where you really work together to come up with the best solutions. Having served in the House, I do see the difference. Sometimes the Senate were the kind of more moderate folks who were able to stop bad legislation. So I think it's really important to have the best people possible to be one of only 40 senators. So I ran, I had been running for re-election, and I ran in changed seats that I was running for to the Senate seat at the end of May. I had a very contentious primary. You may have seen my face on TV quite a bit. A lot of it put out by my opponent. It was very difficult, but I obviously won that very handedly. I'm really proud of the work that we put in, the response from the constituents, and I'm excited to be running in the general election as a Democratic nominee. In my time as the House representative, I think the most important thing that we do is constituent services. And I feel that our office has been really strong on that front, especially during this pandemic. We have worked nonstop on the unemployment crisis, mostly on getting testing to our area, on helping our constituents with any problems that they have as a result of this, such as needing food, needing shelter, testing results, etc. We've been really involved in everything, but as I said, unemployment has taken up a huge amount of time. Our office has basically turned into Department of Economic Opportunity agency, where we're funneling through claims and trying to help people get the money that they deserve in this crisis. It's a broken system. I have some legislative ideas on how to fix it, and I hope to be back in Tallahassee in March to be able to get more money for individuals, because $275 a week is paltry and 12 weeks is not enough. So I know that I will be able to work with my Republican colleagues to get this done, because every single legislator has had to deal with this because of the failure of our governor and leadership in taking care of this crisis. It has fallen upon each of our offices to really help our constituents and do it in whatever manner we can figure out how to do it, instead of having kind of a statewide response to this crisis. Some other things that I intend to work on, continue the work that I've done with gun safety, with school safety, with public school funding, with getting veteran teachers paid. We got new teachers paid, but we have to work on veteran teachers now, getting the right to vote. I'm very upset at what our governor is doing with respect to Amendment 4, fighting us in court, even though overwhelmingly we voted for felons to be able to have their rights to vote. We need to continue working on voter access. And so there's a lot that needs to get done, and I feel that I am the strongest person for this position. Most of the House district is in this Senate seat, so I know the area, I know the constituents. They know me, they know I'm accessible, I'm there for them, I'm very responsive, I have a great team. My team is ready to go on day one, I'm ready to go on day one. It's going to be a very difficult session that we have coming up, but I feel that I am the right person for that Senate position. I was honored to be, sorry, just one last thing. I was honored to be endorsed by Hispanic Vote of Palm Beach. I'm not really sure what the difference is in your organizations. I'd love to hear that. But I was honored to be endorsed by them. Just, I think today or yesterday I received that. So I look forward to continuing discussions with you all. Thank you for having me tonight.
Thank you, Mrs. Polsky. And Mr. Norton, your turn.
Well, thank you. Thank you for the opportunity to speak with you all tonight. A little bit about myself. I'm a first-time candidate. This is the first time I've run, and I'm approaching this entire campaign and my priorities based upon the perspective of a voter, right? Like many of you, we pick our heads up during election season. We listen to what the candidates have to say. We make informed decisions, and then we put our heads back down and get back to work, focus on our businesses, our family, ourselves. And for season after season, year after year, we keep hearing a lot of promises that don't end up being fulfilled. And that's one of the things that drove me into this race. You know, I'm the son of an immigrant from Colombia, a son of a Navy officer, and growing up all across the US, you know, one of the things that was instilled within me was respect for, you know, traditional values, as well as making sure that you help out the community and you stay connected with family in your community. And so when I approached this race back in February before my opponent got in, you know, I was focused on healthcare, education, the environment, the issues that we all agree on, right? That 90% in the middle where everybody agrees, hey, we got to tackle this issue. And that's where my campaign still is. Although the pandemic has thrown everything a bit haywire, we're still focused on those same issues. We're still focused on making sure that we get the resources that we need to maintain control of the pandemic, right? It's going to be not very, very difficult for numbers to start spiking back up if we don't do our part, if we don't maintain control, and that sets everybody back. So one of the key things that I would like to be able to do is make sure that our counties, our cities, our school districts, you know, or even our small businesses have access to not only the PPE that they need, but are getting the support from the state, whether it's through CARES Act or additional dollars as needed, to make sure that we keep COVID under control, right? And that real reason is so that we can start to approach getting back to normal, right? That's about getting people back to work. That's about helping people stay in their homes. You know, we have about 10% of mortgage holders that are delinquent in their mortgages, right? We have a lot of people that are up for eviction, whether it's business or where they live. And we have got to start to tackle the negative consequences of what we did with the shutdown that was designed to keep us safe, and it did, but it's having these lingering consequences. And that's where I'm focused on making sure that we don't neglect those consequences, that we start to tackle them on day one, start to make sure that we can help people get back to work safely, get businesses reopened, keep our kids in school, and provide the necessary infrastructure that we need so that everybody can live their best lives. You know, as an outsider, you know, like I said, I'm approaching this from the community perspective. And what gives me a great perspective is the fact that for nearly a decade, I owned and operated a landscape company here in Palm Beach County. I started it when I was living in Wellington, continued it when I lived in West Boca. And what that really gave me the ability to do was to talk to the people every single day. Hey, what are the issues you're facing, right? How can I help you as an owner so that you can focus, you know, on your job and not having to focus on the issues at home, right? It's enabled me to get all across the community, in and out of neighborhoods, understand what are the issues that are facing them and how we can help. And that's one of the core things that I'm looking to do here as your next state senator. It really comes down to identifying and tackling the issues that we all agree on. You know, as a voter, I've been frustrated at the fact that we use the same issues year after year, election after election, you know, to go this way or that way to win elections. And I think it's time that we start to tackle these issues, you know, from a different perspective. Instead of making it a this or that, a Democrat or Republican, issues to the people aren't that way. It's really about getting things done. It's about moving forward and helping to bridge, a future that we can all be proud of, that we can all participate in. So on top of getting us back to work, getting investment in our community, keeping the pandemic under control, I want to make sure that we're continuing to tackle the issues with public education, to make sure that our goal with public education is to make sure that our children will learn as much as we're willing to teach, right? To make sure that we're continuing to not only fund public schools, but to fund school choice options, to make sure that we're funding properly, affordable housing and other infrastructure projects. So for me, it's tackling all those issues, like I said, that we all agree on, that we need to get done, and stop letting, the far right and the far left decide, oh, we can't tackle this because we're making this into a partisan issue. For me, it's not about being partisan. It's about working together. It's about coming forward with opportunity to get things done. And I believe that I can get that done for you.
Sorry, I was muted. Thank you, Thank you very much, Mr. Norton. I'm going to go ahead and open the floor for questions. And I'm going to start with Mirta Luaces, who is here on behalf of La Guia News. Mrs. Luaces, do you have any questions for the candidates? And if you do, for who?
Yes, I have one question for Ms. Tina. Thank you for being here tonight. Ms. Tina, you have talked about the healthcare to implement a system or a solution to make healthcare more affordable. If you get elected or you have been on the legislature or in the legislature already, what solutions would you implement to make healthcare more affordable?
Thank you. That's a great question. It's so important now in light of the pandemic and so many people losing their jobs. It kind of shows the fallacy of healthcare being tied to employment. And when we rely upon that in a situation when people start to lose their jobs, then they have no health care. So one thing I would do in the state legislature is I would vote for Medicaid expansion. That would give over 800,000 Floridians the opportunity to have health care. A lot of this is done at the federal level. And so I certainly hope that our Supreme Court and whatever that format that may take in the future will vote against the Trump request for getting rid of Obamacare, because it gets rid of pre-existing conditions. So we have to really hope and vote the right way in order to get the Supreme Court to keep, I'm sorry, I'm just reading the chat. I don't think there's any background noise where I am, so I hope that it's not me. So anyway, we have to make sure that our current affordable healthcare system stays in place, but we can do better. And so the fact that our leadership has not taken the opportunity for Medicaid expansion over several of the last two governors is very upsetting to me. And I think that is the best way to handle it. I think we need to put more money into mental health counseling, because we're just not addressing that crucial issue, especially during the pandemic. A lot of people are having some serious problems with that. But also we need to deal with equality. We're seeing healthcare access being one of the reasons why minority communities are suffering greater from COVID and dying at higher rates. And one of the reasons is access to good healthcare, not having health insurance, not being able to go to the doctor, and not being treated with the respect that they deserve if they do go to a hospital or a doctor. So if we need to set up more clinics in areas that are underserved, then that's what we need to do. But unfortunately, it's going to all take money, and it's going to take priorities from leadership and the governor for healthcare, which unfortunately I believe is not a priority of this current administration.
Thank you.
You're welcome.
I'm sorry. I have a lot of background noise, so I'm writing my questions, Daniel, for later. All right.
Oh, thank you so much.
I'm the one. Okay.
Thank you, Ms. Vidal. I want to give an opportunity to Mr. Norton to answer the question.
I have more or less the same question for Mr. Norton. And but he said that there have to be reforms on areas that it can be controlled by the state. So what reforms will you be doing if you get elected?
Yeah, I appreciate the question, because this is one of the issues that's very important to me and I'm very passionate about. I know a lot of times we like to talk about how we're going to cover more people by talking about who's going to pay for it. But the question that we should be asking ourselves, if we really want a quality, affordable healthcare, is how do we start to tackle the issues that have caused a rise in healthcare? If you look back over the last 30 years, healthcare has risen much faster than other industries. And it's because of the fact that we haven't been tackling the issues that caused the rise in healthcare that has led to this. What am I talking about? It's very simple. It's too many hands in the cookie jar. So if you look at like pharmacy benefit managers, people that are taking money out of the system to give back to drug makers instead of passing those savings on to the consumer, right? I'm talking about ways that we can do tort reform to reduce the defensive practice of medicine, right? Things that are raising the cost of doing medicine. So instead of going to your physician and it costing you, X, it's starting to cost you Y, because there's people in there that are in between your doctor and you that take a little bit of money out of the system, right? There are physicians out there who have to practice a certain way in order to avoid being sued. So there's a lot of things that we're doing, and a lot of it stems from government overreach, right? Or trying to do a good thing, but it has a negative consequence. If you look at the growth of healthcare administrators over time, they greatly outpace, patient growth. They greatly outpace, physician growth. And the reason for that is because every time there's a new law passed, right, hospitals have to deal with it. Physicians in their offices have to deal with it. And that takes away time that doctors can spend away from their patients and puts it towards these administrative costs. And that just ends up leading to a greater cost of medicine and a reduced access. One of my goals is to really incentivize and bring in more physicians into South Florida, right? To increase opportunity so you don't have to wait months to get an appointment, right? So you don't have to go to the ER to get something that should go to your primary. So that's one of the many ways that I'm looking to help reduce the cost of medicine so that we can cover more people for less money.
I have a follow-up question, Mr. Norton, and I'm going to preface this with, I'm going to be asking some tough questions based on the answers that are provided by both candidates. I'm not a big proponent of Medicare for all whatsoever. I believe that there's a there's a place for people to also have their insurance, because doctors need to make money, and if you go on with Medicare rates, they may not make the money that they need to make in order to pay for their expenses and pay for other things that they need to pay to run a practice. I understand that because I do a lot of business litigation. But I take issue with your position for two reasons. The first one is there is a system called workers' compensation, or PIP, where the government allows the insurance carrier to dictate who the employee, who the laborer is going to see as a doctor. And those doctors oftentimes will terminate or not provide sufficient care for the employee, because those are doctors that this administrative system requires the employee to see, who are paid by the insurance carrier. So in that regard, in one breath, you have the insurance carrier paying for doctors and telling the person who to see as a doctor, and they have no other choice. And then on the other hand, I have an issue with the whole idea that you need tort reform, because in Florida, as is, it's very difficult for people to sue a doctor for malpractice. It takes thousands of dollars for somebody to pay an expert, for that expert to then provide an opinion as to whether or not they believe this doctor actually committed malpractice. So to change the system to make it even more difficult could in fact result in doctors just not even caring at all to provide proper care for their patients. So my question for you is, how do you propose to keep the government out of healthcare when the government is already in healthcare by way of this workers' compensation system that effectively that's what it is? And two, are you willing to take a second look at your I would say tort reform agenda, which is something that I don't believe is necessary in Florida, and I don't even practice medical malpractice, but I know how difficult it is, so that people who actually vote for you feel confident that if they go to a doctor, they can actually feel okay that the doctor is going to have at least a little bit of concern that if they don't do it, if they chop off the wrong leg, that they're going to have a recourse.
Yeah, I appreciate your question, Daniel. And I agree with you with most of what you said, right? So when it comes to insurance companies, right, and this is where I'm talking about government overreach, about them dictating who people have to go to me is a bridge a little bit too far, right? And I say that because I've had my own employees that have gotten hurt on the job, and they have a hard time getting what they need through the workers' compensation, right? It's a struggle. Right, so having a way of having a check and a balance is important, right? And we've got to find a way that allows people to get the care that they need, right, without infringing upon their rights to receive that care. When it comes to tort reform, I'm not talking about if you chop off the wrong leg, you can't do anything. What I'm referring to is there have been numerous studies, both at the federal level and here at the state level, that shows that one of the reasons why our healthcare keeps going up year to year to year to year is because of the defensive practice of medicine, right? And we have got to start to find ways to change the behavior of our physicians so that they're not afraid, you know, when somebody comes in their office and they think, well, I got to run every single test because I don't want to run the risk of somebody sometime, someday that I don't know coming back and suing, right? And it's not about not providing care. It's about making sure that we're intelligently addressing the issues that are causing the rise in healthcare. Right, you do need to have the ability to sue a physician if they mess up, if they don't provide the proper care, but you also need to provide enough, disincentive to physicians to not practice or over practice medicine where they're ordering excess procedures just because of the fact, like I said, that they don't want to be pressured into, a decision that clinically isn't there, right? And the story after story, when you talk to physicians, that's in the top of their mind, right? Every single day, whether it's a surgeon or a primary care, right? That's on their mind of making sure that I'm covering, dotting all my I's, crossing all my T's, and doing above and beyond, and more than probably what I clinically think I should do, because I don't want to run that risk, right? And that's a real risk they think about, and it's one of the largest causes for the growth in the cost of medicine.
Thank you, Mrs. Polsky. Let me just follow up, and then I'll go for the next question because we're in this topic right now. My question to you is, oftentimes when a doctor sees a patient, they tend to bill for several codes for their treatment that they're providing as they're seeing the patient. And as they're billing for several codes, they are able to maximize their ability to collect money for the work that they're doing. So how are you planning to ensure that the system of healthcare is able to be sustainable if you want to go with a platform of Medicare for all, which I don't know if it's going to be feasible or reasonable when you have a majority of Republicans in the chamber that you're running for?
Well, I don't know that it's Medicare for all. It's an accessibility of Medicare for more people. I mean, just imagine if we had 800,000 people all paying small premiums for better healthcare, then we would have a larger body who are contributing to the healthcare system, to the insurance, and that actually can keep rates down. You need more people in the system paying in, and when healthy people pay in, then it brings everyone's rates down and it provides more accessibility. If you have private insurance that you want to use, you can still use that. It's just an option for people. Medicaid expansion is an option for those who have nothing to be able to buy in to some kind of insurance because it's just not accessible. What Brian was talking about is, bringing down the rate for a physician. I mean, is that going to change how much someone's going to pay out of pocket to go to the doctor? They're not going to go to the doctor at all. It doesn't matter if they're charging $100 for a physical or $90 for a physical. They don't have the money to do that. they have to go to a free clinic if there are any available to them. So they have no insurance at all. So they're not even seeing doctors. So it's just not even an issue. There's no accessibility. And that's the difference, is that you need accessibility and you need the opportunity to have health insurance. Everyone should have the health insurance that I have as a state representative. It's the best insurance I've ever had. Before I became a state rep, I was paying into the system as an individual business owner, as a mediator in my family of 4. It was a fortune. And now I'm in the state program and it's incredible. And everyone should have that opportunity. If everybody could buy into the state system, then they would have great access. And I think that it would be affordable because so many people would be buying in. There's 21 million people in Florida. If people wanted to buy in, they could afford this kind of insurance. It just has to be made available.
And there's a question for Mrs. Vidal, and the question is to Mr. Norton. And her question is about accessibility, because Mrs. Polsky just talked about that. And the question is, how do you propose to provide accessibility to health insurance to those who cannot afford it?
Yeah, it's a great question. One of the areas where I'm looking to expand funding for accessibility is making sure that our healthcare districts have the funding that they need to cover that gap, right? Whether you're, and you can't afford health insurance. And I know as myself, as a family of 5, under the Affordable Care Act, my insurance personally went up from about $800 a month to $2,500 a month within 2 years, right? Which was completely outrageous, right? So there are people who are in the middle class that still can't afford healthcare, right? So we have to bridge that gap. And part of that comes through the healthcare districts, but it also comes through lowering the cost of medicine so that more people can get into private insurance, right? It's making sure that our Medicaid and Medicare are covering the issues that need to be covered, the services that need to be covered, but also we need to make sure that we have more physicians, right? More competition is going to yield a better result, right? So having funding for healthcare districts to bridge that gap, right? I'm all for continuing to fund other private institutions that provide, free clinic services, right? To make sure that that gap remains bridged, and that as we lower the cost of medicine over time, where people can enroll on their own accord and choose what plan is best for them, that we continue to target those issues and to make sure that, everybody has access to quality, affordable healthcare. I completely agree, that access to healthcare is a vital, important issue, but we have to find economically feasible solutions that allow everyone to participate at their own level and give people the choice to decide what is best for them and their families, while at the same time providing sufficient, infrastructure for those that can't afford it to go in there and get access to free clinics or low-cost clinics.
Thank you very much. The next question from Mrs. Vidal is for Mrs. Polsky. And Mrs. Vidal, I would like to know if you can advance some of your ideas to resolve the unemployment problem in Florida.
Sure, happy to describe that. Unfortunately, I've become an expert in this because of the needs of my constituents, and it's been a really sad situation. There are people who have nothing and couldn't log into the system. So first, as I think I may have mentioned, $275 a week is not enough. So I can guarantee you there will be legislation put forward in March in 2021 to raise the amount from $275. I don't know what the ideal number is. We'll have to do some research into that. And I'm sure it's a number that will be negotiated. 12 weeks is also not enough. Obviously, we've been in this pandemic for 6 months. So if someone lost their job because of the pandemic, and it's not necessarily because of shutdown, it's because of some businesses are just not coming back, even though they're allowed to be open now. So there's just not enough customers, and a restaurant, for example, just can't afford to keep people on. They don't need as many staff. So it's through no fault of their own. So we need to increase the number of weeks. As far as the system goes, the $70 million unemployment insurance system, it's a fully automated technology database that people log into, failed as soon as it was really, really needed. Even prior to the pandemic, when there weren't a million claims being filed, it would knock people off. So I'm sure you've all experienced a situation where you're trying to log into something, you do a few steps, you do those verify sidewalks, and then you go through all that and it logs you out. This is what was happening over and over again with this system. It was designed to fail. Even Governor DeSantis said that about Governor Scott, that the system that we paid as taxpayers $70 million for was designed to fail. They try to make it so difficult for you that after a few attempts, you just give up. If you don't do your claim, it doesn't get logged in, the state doesn't pay it out, and our numbers look better. And that is why the system was designed the way it was. Now comes the pandemic and 1 million people trying to log on at once. It just is exploding and worse than even normal. So my suggestion would be a complete overhaul of that system from a technological standpoint. But also you need more human beings to be able to have the expertise to work the system. So after a couple of months, the governor decided to hire some temporary workers who didn't know what they were doing. So they'd answer the phone, pass along a message, or give the wrong information. It did not help my constituents one bit. He knew about this a year before the pandemic, and he did nothing. He knew from an audit that the technology wasn't working, and he did nothing to fix it. So he's got to fix it. I lay the blame completely at his feet for this. And so has to be a lot. We need more human beings who work this system. My idea is that if we don't have as many people needed for the unemployment system, they work in other areas. They work in economic development. They work at career source local offices throughout the state. Our career source office in Palm Beach County didn't even open when things allowed to open. We need more accessibility for people to go into an office and work with a human being to help file their claim. So it's a little bit like insurance, health insurance, you know, when they deny your claim and then you keep fighting and fighting, and if you keep pushing, eventually you'll win. It's the same thing. And a friend of mine just did an appeal after months and months and months of them ignoring her, and she got it through now. But you have to be so persistent, and many people give up. And that's the problem with the unemployment system.
Thank you very much, Mr. Norton. The same question is for you as it relates to resolving the problems with unemployment.
So number one, you know, my opponent, Representative Polsky is correct. The current system that's in place isn't working, right? And we have got to fix it. And because of the way the legislature is made up, it's going to be the Republicans that are going to get their way through. And one of the areas where I think we can do a great benefit is not only making the system work, because I'm a strong believer that if the government says they're going to do something, they should do it well. They should do it effectively. Whether you agree with it or not, it should be done competently, right? And you know, and I agree. We need to be looking at 275 is not enough, right? 12 weeks, especially during the pandemic, is not enough. But we also can't be harming the businesses and raising their mod rates at the same time, because it wasn't businesses' fault why they had to let so many people go. Right? We've had a lot of people lose their family business that they've invested years and fortunes in. We've had a lot of people lose their jobs that they've invested their own fortunes and their own time into. So we've got to start to find ways to get them back to work. And that all starts with with us going out there and keeping the pandemic under control. You know, the public has got to see that we have this under control, that we're keeping it under control. And that requires us to be a bit more aggressive in how we're tackling these hotspots, because we have to assume that more hotspots will pop up, right? And we've got to have a plan that's more than mass social distancing and hand washing to make sure that the people are confident in what we're trying to do, and that they're confident that we're going to keep this under control, because that's how we get people back to work. That's how we get businesses reopened, right? I've talked with many restaurants. I've talked with many small businesses as I've gone on the campaign trail, and they all tell me the same thing. They're concerned about opening up because they're going to have to shut down all over again. Why are they going to invest all this money now if they're going to have to shut down again? And that's the first issue that we've got to tackle. Second, with getting people back to work, we have got to provide incentive programs for small businesses and other businesses to rehire their employees, right? That's making sure that those things that they're afraid of to reopen, we take those things off the table for them. So, you know, on top of that, getting people that have lost their jobs, opportunities to go back to school, back for retraining, all these are important, but everything starts with making sure that the pandemic is under control and stays under control.
Thank you very much. Now I'm gonna move it along, and I'm gonna now start keeping track of the time because it's getting late. And I'm gonna ask Mr. Juan Pagan, who is also a member of HISPAC and also the president of the Puerto Rican Hispanic Chamber of Commerce of Palm Beach County to ask the next question. Mr. Pagan?
Hi, good evening, everybody, and welcome. The question I'm going to have is going to be going back to the broken unemployment system. It so happened that 10 years ago, after 35 years with the company, I got laid off, and I went through the unemployment process, tried to apply. Well, move forward. I found a job, blah, 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 been working since then and all that. And I applied retirement and all that. But now, during the COVID, I got hundreds and hundreds of calls of people asking me to help them. So what I did, I went back to the form. And guess what? Was reliving all over again the nightmare that I had 10 years ago. It was a total nightmare. Now, my question to you is, to both of you, as a politician, why you have to point the fingers to the government? And not, if you've been working there, why not you take care of it and fix it? It's about time that this gets fixed some way or another. So, Ms. Polsky, you
Sure.
first, ladies first, always.
Thank you. I'll be happy to try to answer that. I wasn't, nor was Mr. Norton, in office when this new system was put in. The one that you applied for is not the same system now, because I believe it was voted in 2011, if I'm not mistaken.
If I may interrupt, the change was, if we were to measure it, we will not measure it in inches. We will measure in centimeters, the changes that were done. And they were actually made more difficult to discourage people filling out for unemployment.
Absolutely. And the reason is because they want to keep the unemployment numbers down. It's more important to look good to the outside. So look, I'm all for economic development. I spent a huge amount of time trying to economic development in the Glades area that this Senate seat and my current House seat represent. We need businesses there, and I spent a lot of time trying to help them with that. And I work with DEO actually on that issue. But just to keep our numbers down and to keep people who need unemployment assistance, who they have paid into the system. The employers have paid into the system. And when their employees need it, it should be there for them. And so the fact that it doesn't work is a huge issue. And if it was designed so to keep the numbers down, that's a problem. So I wasn't in office then. I didn't vote for that particular system. Really, one of 120 legislators or 120 House members is not going to be able to say the system is broken, we need to fix it, especially when we don't have that knowledge. The governor did an audit and knew that there were problems with the technology and nothing was done. So, pointing fingers, people ask me all the time, what would you do differently? That's like a question that we get asked in every forum. What would you do differently? I have to answer it that way because that's what they did. They did it. They have to own it. The buck stops there. What would I do now that I'm aware of the situation, because I receive hundreds of calls as well, is now I know what the problem is and I'm trying to fix it. I'm suggesting solutions. I'm suggesting more humans instead of all technology. I'm suggesting more localized career centers so people can go to them and meet with a person across the table and go over the system with them. They can provide job opportunities at a career center instead of just applying and waiting. So I am suggesting very concrete changes that can be made. I'm also saying we shouldn't hire Deloitte & Touche again to be in charge of our Medicaid system, which is now who has won the contract, the same company that put in the Connect system. So there are tangible things that I am suggesting that we do that I will personally propose in legislation in my own name, or if other people propose it, I will co-sponsor that legislation. What have we done? We have tried to figure out this system from day one. We have banded together with other legislative offices. We have figured out tricks and solutions. We put out a newsletter almost every other day at the beginning of this pandemic to help people. We would send emails, try going on at 4 a.m., try using your phone. Here are forms. If you fill out a form physically and send it in, FedEx is going to send it in for you for free. I put out forms outside my office in Creole, in Spanish, and in English outside my office so that people could come get them. And we could help them fill out the forms. Myself and my aides sat and cried with people on the phone and tried to help them fill this out. And we work nonstop. We put names in to the to DEO and say, help us with the system, do this password reset. So there are very tangible things that we have done to help our constituents and very tangible things that I am suggesting that we do going forward to fix the system.
Thank you very much. Mr. Norton?
Yeah, well like my opponent said, neither of us were in office at the time it was passed, right? This is my first campaign. I'm coming at this, the same perspective that you are, right? When I had my landscape company, I had over 30 employees. And from time to time, we had to lay people off. And we had people that came to us and said, can you help me fill this out? And we were certainly happy to do so because it was their prerogative to get their unemployment. But at the end of the day, we need systems that work. Like I said before, I'm a strong believer that if the government has a system, it should work, right? It should work effectively, it should be efficient, and it should make sure that it accomplishes the goal that we set forth. So I'm in agreement that we have got to put forth legislation and work with DEO to get those changes necessary. And it shouldn't have cost all the money that we spent. I think, we spent nearly, was it $70 million on that system? And there's no reason why it should cost that much. Before I was in landscaping, I was an IT professional for 8 years, right? And I built enterprise. I helped build a lot of systems that are still in use today. And it's not that hard. And it requires somebody that understands technology and understands the quick, simple fixes that are needed, because oftentimes that's what it is to get things working, right? And on top of more human assets, more physical places where they can send it in, we have got to make sure that the online system works, because a majority of people are moving to online, and it has got to be a top priority for us.
Thank you very much. Next, I'm going to move on to Mr. Santos Arroyo, who is also a member of HISPAC, and he is a founder of the Palm Beach County Puerto Rican Hispanic Chamber of Commerce and Fiesta del Pueblo, and other community outreach ventures here in Palm Beach County, Florida, and elsewhere as well. Mr. Arroyo?
Yes, my question is, what will you do? And I'm gonna address this first to Mrs. Polsky. What will you do to keep our farm workers safe at work and improve the neighborhoods where our farm workers live?
Sure, that's a very important question. A huge part of representing District 81, where I represent now, and also the Senate District, which covers most of the same area, is representing the agricultural areas of the Glades. And I have had the pleasure and some, disdain for seeing the situation that some of the farm workers have to live in. There have been some great strides made. There are some real advocates out there trying to push the federal government, who is oftentimes in charge of this federal housing for farm workers, for seasonal migrant laborers. So I did a tour of one of the new facilities, and they're really trying to make some improvements. But I work with Commissioner Melissa McKinley, and I met with USDA talking about some of the seriously roach-infested living conditions that USDA provides to people who work in the agricultural industry. So I've been a strong advocate for trying to help them as best we can. During the pandemic, they, again, were treated very poorly, not given the PPE, but still working under terrible conditions. So I think it's very important to consistently, raise up their voices and be aware of the area. Another issue that we have to deal with is just supporting agriculture. These are their jobs. Palm Beach County is the largest agricultural area east of the Mississippi. People don't really know that, who just live in our suburban sprawl, but representing this area for 2 years, I have learned so much about agriculture and how important it is. There are some great jobs out there. There's really good paying union jobs with a lot of them. There's some great new technology jobs. I've had the pleasure of touring all of these facilities and learning about them. And they get a bad rap very often. And I find myself in a very unique position representing agriculture, but also I consider myself an environmentalist. And oftentimes the two are at odds, and they really shouldn't be, because the farmers are the stewards of the land. And I know they want to keep the land as best they can. I was very honored to be endorsed by the Sierra Club for the positions that I take on environment, but at the same time, I'm very supportive of our agriculture. So supporting the farms, supporting their workers, making sure the housing is appropriate, making sure that they have the proper PPE and the proper protections. And there's some really great advocates out there in the Glades who are doing really good work. So I hope to continue to be a strong advocate for them should I win this Senate seat.
Thank you very much. And Mr. Norton?
Yeah. One of the best ways I believe that we can help the quality of life for our agricultural workers is by incentivizing and getting more businesses into the area of the Glades, right? To raise that quality of life, to continue to properly fund, public housing. I know it's very expensive to build out there in the Glades because of the muck soil. And we've got to start to put money towards helping businesses come in there, like manufacturing, and other small businesses, putting programs in there and grants, small grants to allow, minorities to start their own small business, because that's one of the ways that we can really lift everybody up out there, whether you're a migrant worker or a full-time, farm worker. We've got to start to put the right programs in place for that community, because what's best for, the agriculture area isn't what's best for Boca. And we've got to realize that and target our programs specifically towards those communities. Like my opponent said, access to PPE is vitally important, but it's also access to information, right? Education is the greatest thing that we can provide for those communities, right? Whether it's education about what's going on with the pandemic and what they can do to keep themselves and their families safe, but also making sure that their children receive proper educations when they're out there, so that their children can grow up and have the opportunity, like every other American, to pursue their dreams. So it's that kind of programs that I look forward to implementing to really help out, our workers out in the farms.
I just want to add something if I can. I've been heavily involved in the economic development in the Glades. And I have to say that the Republican leadership does not put the money there. They are not interested in, they'll call corporate welfare. They are not interested in helping private businesses. The Business Development Board of Palm Beach County does an amazing job of working on businesses across Palm Beach County, but especially the Glades. They have an individual there who works exclusively on that. I have been involved very heavily in strategy meetings of projects that are going on. I've tried to get more money out of DEO to help with the demucking so that the land is comparable and you can build big, heavy manufacturing facilities there. In fact, we worked on it during the last session because there is a manufacturing facility that wants to move there, but it's very expensive to prepare the land. So we asked the governor, we asked DEO if we could get money for that, and they said no. And there's many examples of the Republican leadership not providing incentive money to be able to create economic development. That's that whole problem with Visit Florida and Enterprise Florida, where they keep threatening to get rid of it. And so just be aware that as much as you want to increase economic development and help lift many up, we need help from the top to do that. And right now we're not getting it.
Yeah, I completely hear you, right? And as a Republican, I'm going to be able to go to the governor.
No, you're not.
I can make
Let's not
I'm not going
interrupt
to hand
each
you
other.
money, Brian. I'm sorry.
Hold on. Hang on. The format doesn't allow for interruptions like that. Mr. Norton, you have the word.
Yeah, I was just going to say, as a Republican, I'm going to have that opportunity to go to Senate leadership, to go to the governor and make that essay. Hey, this is what I need for my community. What can you do? How can you help me to get what we need? Because they're willing to help other Republicans in other Republican districts. They'll be willing to help me as well.
All right.
Sorry.
It's
not how it works.
Okay. And finally, we have Mr. Roman. Where are we? Yes, Mr. Sam Roman, who's also a member of HISPAC. I like to give you the floor for your question.
I have several questions, and those have been answered. I just have one specific question for both candidates. What type of outreach have you done to the Hispanic community so they get to know your platform and know you better as a candidate?
Would you like me to start?
Yes.
Sure, Mrs. Polsky.
Sure. Well, as the state representative, I've reached out to all communities. As I mentioned, many folks in the Glades. We've done quite a bit of outreach and community involvement. I've had food distributions in both the Glades and an area that probably has never seen a food distribution before, which is the Sandalfoot area of West Boca. We worked with a church. I don't know if you're familiar with the area. I don't know where you all live, but we worked with the church to hold it in their parking lot, right in the heart of the Sandalfoot area of West Boca, to distribute food. And that had never been done before. And even people in the county commission had no interest in helping us because they didn't think it was necessary. But we got rid of that food in 2 minutes. Well, that's an exaggeration, but it was heavily needed and people were really excited for the help that we were able to give. We do community outreach at the, there's a police substation in the Sandalfoot area. And we've gone there. There was a dental clinic and we've gone there and talked to people and, explained our services and, asked whoever needed help that, what the services we provide and how they can reach out to us if need be. So, through different kinds of legislation that I propose, I believe it helps, all communities, especially minority communities. As I said, I received the endorsement of Hispanic vote of Palm Beach. I'm not sure, what the different platforms that you guys have versus them, but I was very proud to receive their endorsement. And so, I believe I'm accessible and out there and, willing to work with anyone in the community who would like to meet with us and work with everyone who needs it.
Thank you, Mr. Norton.
Yeah, I appreciate the question, Sam. What we've been doing is we've been putting out several ads and campaign literature in Spanish. We also have several volunteers that are dedicated to the Hispanic community, right? We go when we do knocking on doors or we do outreach programs, we make sure that we have people who, if necessary, who can translate, but also to make sure that we're addressing the issues that are important to them. And here on the campaign trail, right now, a lot of it is about economics. It's about getting back to work. It's about being secure in their homes and public safety. And those are the issues that we're addressing on the campaign trail to make sure that everybody has the same opportunity, to get through this. And I believe that we can get through this, and we just have to work together.
Thank you very much. And now, 1 second. There's a question from Mrs. Vidal, and her question is, how are each of the candidates reaching out to local students? I presume would be students who may be of age to soon to vote, probably in high school, seniors and the like, to get them involved in the and knowing about the importance of voting and their rights and how these issues are going to affect them, because, and this is now me talking, her question ended, because voting for a state representative or state senator has a direct impact on every citizen in the state of Florida, because every citizen has to deal with the laws that you all are in charge of discussing in your committee and passing in the legislature for the governor's signature. So what are you doing to include this young people as part of this efforts to educate them? And you can start, Mr. Norton.
All right, thank you. Yeah, I mean, it's one of the areas that we're targeting heavily on social media. We have a lot of high school volunteers that are helping us, whether it's putting out yard signs, knocking on doors, and just engaging them. We're also doing a meet the candidate forum with FAU students to come in and ask questions, to learn more about the process, and to ask questions directly to the representative. I completely agree. It's vitally important that our young folks get access to candidates and be able to engage in the process, because they're the ones that have to suffer and deal with all the consequences of what we do. So, those are some of the ways that we're out there reaching to the young people.
Ms. Polsky?
Sure. Well, I have to start. I have a 19-year-old daughter who has been very involved in both of my campaigns, and her friends have become very engaged, which I don't think, they would have been otherwise. So they push it out to their friends, and you know how that works on social media with that age group. So that's really exciting to me. put out my signs, wear my shirts, and get very involved in that end of the campaign. I have hired interns over the last several years to work in our offices, and we've been able to work with them, teach them the legislative process, and they help us, and they do great work, and they learn. I'm very involved with a group called Moms Demand Action. That is a group which is fighting for gun safety all over, but mostly in the schools. And they have a subgroup called Students Demand Action. And prior to becoming the representative, one of my charitable endeavors is called Kindness Matters. And we bring the Kindness Matters Club to high schools and elementary school, middle school, and high schools. And I brought a Students Demand Action group to my daughter's high school at West Boca High, and to start a chapter there. And then very recently, I did a Zoom with the folks from Students Demand Action to engage them in the process and get them excited and voting in the primary and voting in the general election. And they asked me a lot of questions, very specific about gun safety legislation, et cetera. So I'm really impressed and excited by the youth turnout and their interest in the political process. So I love to work with them, and feel like we've been doing a really good job of that. And the turnout for my primary was extraordinary. We had 15,000 more people vote in that primary than did 4 years ago, and that's an awful lot. So I think people are really engaged, and I'm excited about that for the general election.
Thank you very much. And now you have 2 minutes to close. So, Mrs. Polsky.
Sure. This election is really important for so many reasons. Your next state senator, I don't know if you folks live in District 29, but the state senator, there's only one of 40. And you have so much responsibility for 450,000 people and numerous cities, a large part of unincorporated Palm Beach County and also Broward County. And you need someone with the experience who knows what's going on in Tallahassee, who knows how to manage constituent services, who has a team on the ground ready to go, who has tons of experience. And we are ready to go on day one. This session doesn't start until March of 2021. There's a lot that can happen between now and then. But you want to elect the person who represents the folks of this district, who has done so over the past 2 years, who has provided great constituent service, who is there, who is accessible. I go to all the meetings, I'm there, people know who I am, and it makes people feel comfortable. And I think that's the important thing, that they know that they can reach out to their state representative or state senator and know that they will be heard. You don't know the answer to everything, but you need the kind of person who's intelligent and reasonable and will research and hear from all parties and do their due diligence on legislation. And you need the kind of person who's going to represent the district. And I believe that I am that person, and I'm ready to go. And I think I'm the best person to become the next state senator from District 29. And thank you for your time tonight.
Thank you very much. Mr. Norton?
Yeah. This campaign, this election, it's not about me. It's not about my opponent. It's about the people of our community, right? It's about getting the people what they need now. And I believe that I'm the best person to enable us to do that. And I say that because of the fact that every issue that I come from and come towards, it's from the voter's perspective, right? It's not from the perspective of somebody who's been in Tallahassee and about how things work. As a small business owner, if you told me, Brian, you can't do this, you can't do it that way, you can't do it that way, I never would have succeeded, right? I have the ability to persevere, to not give up, and to really continue and drive forward to provide the solutions that I know are going to give us the best results. And I want to be the one who can bridge the gap, right? The person who brings Democrats and Republicans together, right? I'm a Republican. I'm married to a Democrat. I've done this for over a decade, right? I've done this with many other people because Palm Beach County, yes, there's a large Republican population. There's a large Democrat population, but there's also an extremely large independent, nonpartisan population, right? And my approach to this campaign from the very beginning has been to represent the people in the middle, right? Take the ideas that we all agree on, that we all say, we've got to do this, we've got to do that, we've got to do this, and not make it into a partisan issue, but to make it into an issue that both Democrats and Republicans can join into. I'm running, for my community. I'm running for my family. I have 3 small children in grade school, and I want to make sure that they have the opportunity to grow and really thrive here in Palm Beach County and Broward County. I want to make sure that Florida is prepared for what's going to come in the next couple decades, right? Start looking out for the long term rather than just the short term. I'm not one who wants to make things into a partisan issue. I'm one that wants to bring people together, bring everybody to the table and say, hey, what is it? How can we get this thing done? What would you need to get this done? How do we find a win-win solution for everybody? It may not always be possible, but I believe that that's the method that we have to employ if we want to start to move forward, right? Right now, our state, our country is very far apart, right? We have, both sides that are just stuck in their corners, and we need people that are willing to walk that line in the middle and try to bring over people from the right, people from the left, and say, enough is enough. It's time that we get things back to normal. It's time that we start finding solutions that work for everybody. And part of it is by changing the conversation, asking better questions. And that's how I believe that I'll deliver real results for the people in our district.
Thank you very much. And this concludes the candidate forum of HISPAC. I want to thank the candidates, Brian Norton and Tina Polsky, for your attendance. I know it's a little late. I appreciate you are here tonight answering questions. Some very tough questions, I would say. I want to thank obviously each member of HISPAC, Sam Roman, Juan Pagan, Santos Arroyo, Veronica Vidal, and I want to thank La Guia News, Mirtel Luaces, and of course the Puerto Rican Hispanic Chamber for your involvement in Palm Beach County. And I want to thank you again for being here tonight. My name is Daniel Lustig with Pike and Lustig, and thank you so much for your time.
Thank you. Good night,
Thank you.
everyone.
Good night.
Thank you.